insurance is really great, but it really doesn't cover that much or anything that people want. So how do we, with the rising cost of things, how do we solve the problem of affordability?
Welcome everybody to today's Spotlight. We have a very special guest. We have Fiona from Cherry that's here with us. So I just want to welcome you, Fiona. How are you?
I'm good. Thanks for having me.
Awesome. Well, Fiona is a person that is working with all of us to bring Cherry into your practice. And so what I wanted to do is just kind of ask you just a couple questions about yourself, about your company. So if you could just kind of give us a little bit of background about, you and how you got started in this industry.
Yeah, absolutely. So I have actually been working with Cherry and in the elective medical industry for about 2 years now, which has been really exciting. The reason that I was really drawn to it is because they are really solving a problem that I think is really important to a lot of just people in our country and people everywhere, where insurance is really great, but it really doesn't cover that much or anything that people want. So how do we, with the rising cost of things, how do we solve the problem of affordability? Cherry, I think, is the best on the market. I'm not only saying that because I might be a little bit biased because I work here, but for a lot of different reasons, our product is number one, spanning across all elective medical platforms.
Yeah, I mean, you guys, can you tell us a little bit about who you're currently working with as far as, offices and clinics?
Yeah, so we work with about 80,000 clinics nationwide, and that's in every single one of our verticals. So whether it's chiro, whether it's dental, whether it's vet, whether it's audiology, vision, med spa, or plastic surgery, you name it, they've probably heard about us and are in the process of signing up, and if not, have been a loyal Cherry customer for a while now.
Awesome. Yeah. So you work with people all across the country. I know a lot of our doctors, they have they get people in the door. They have marketing, working for them. They have people coming in, but there's a problem with, financials. Typically, that's what we're hearing. It's, the patient didn't start, or they didn't elect to continue care because of financing. What do you think is the biggest challenge right now that you're seeing in your industry?
Yeah, good question. Honestly, so what typically happens, and what I think Cherry has done a really good job with solving, is the old way of financing. Obviously credit cards and financing has been around for forever. This concept isn't a new concept, but a lot of time what happens is that, doctors and doctor hospitals spend so much just to get their name out there and say like, hey, this is an option. Patient then comes in for a consultation. There's a treatment plan that's made for their specific instance. So you guys have invested already time and resources just even into getting that patient walk through the door. Then what ends up happening is once they get that treatment plan, they're obviously given a quote. And then if it's not covered by insurance, which typically for a lot of things, it's not covered by insurance, a lot of times there's sticker shock. And then there's that age-old procrastination of, I need to think about it, or let me go talk to my spouse. And what really happens, and the deeper issue, is maybe saying like, okay, wow, I was just quoted $3,000, but realistically, I'm a human being and I've got, my kids are going back to school. So I've got all my back to school expenses coming up. So it's not really the right time, or maybe not right now. And it's just really put on the back burner. The really saying is like, my health is going to be put on the back burner because I can't afford it all the way right now. So to answer your question, I think one of the biggest challenges is obviously affordability, but also training. Like one thing that we're doing to really combat that is training a lot of practices to really bring that financing conversation to the front of that patient journey versus waiting until the very end. Once that patient has gone along that journey, really gotten hooked and really kind of believed like, okay, I really want to invest in my health and get better, but then I can't afford it. And then leads to, that patient walking out the door and ultimately lost revenue for your clinic.
Yeah, I mean, that's probably one of the biggest challenges that we see as well. So that's why, I thought it was important that we talk and we introduce maybe, can you talk about a little bit about, what makes your guys' approach or solution a little bit different for maybe other people that I know, there's a common company that probably everybody uses, or they're using other financing options. But can you just tell us, like, what do you think makes your guys' approach a little bit different than other people?
Yeah, absolutely. And I think to kind of put it into two big buckets, there's one on like the product side that we do differently, that I'll touch on first. And then there's one on more of like the sales and people side that I spoke about in my first day, or my last, kind of explanation, but I really will also dive deep into what like we're doing as a company differently, where I think it provides a lot of value in the industry. So on more of the product side first, obviously, again, financing isn't new. A lot of people honestly think of a credit card when they hear the word financing, which, as a human being myself, just to go to the chiropractor or go to a med spa, I don't want to open up a credit card for that. So it's definitely like the old version of kind of like, okay, if I really needed this, like I'd have to open up a credit card, which then leads to a lot of different things like a hard credit check. Or if I sign up for a plan, I'm going to get deferred interest. So Cherry doesn't do any of that. We are what's called a buy now, pay later solution, similar to like Klarna or Affirm. They're more on the e-commerce side. But what that comes with is a lot of benefits that are different than traditional financing options. Some of those benefits being a soft credit check versus a hard credit check. The other benefits being is that we have what's called simple interest versus compounding or deferred interest. So you don't have to worry about any hidden fees with us. It's very transparent. It's very easy to use. We're also going to approve more patients. We go down to a much lower credit score, about 520. Versus traditional lenders, you have to be more of that prime patient to be able to move forward. So that's how we're breaking down on the product side, a couple of those barriers that really makes us different. And then on more of the people side, one thing that I think our team and our company really invests in the providers that we work with is teaching them how to actually leverage financing versus just having, another option that looks nice on the shelf, but you're not really doing anything different in the office to help those patients move forward not only with any treatment plan, but the most optimal treatment plan for them. So our team has, tips and tricks and even some marketing pages that we'll actually create for the providers that we work with to really help them leverage financing in a way that does impact your bottom line, ultimately help patients move forward.
Yeah. So what I'm hearing is like you guys have different options. You go down to that 520 credit score, which is great because not everybody has that perfect credit. And if you don't fall in line with that, you're kind of just not going to be accepted, right? And so the idea is that you have the right solutions for some of our doctors here. You also have training, which is great, and then promotional marketing items, which is also great. Tell me a little bit about your platform, because I know that everybody that kind of signs up, I guess, can you explain what that process would look like? So if I'm a doctor, I want to sign up for your office, for your platform, like what would that look like? What would I get, or what are the steps that I would take to actually get set up with you guys?
Yeah, absolutely. So it's super easy. We know that doctors, their time is very valuable. They're doctors first. And this is just one of the things that will make them, more impactful with their patients, but it's not their primary focus. So what we've done is made it as easy as possible. So it's really a 3-step process. The first process is to just book a demo with one of our account reps. And their job is to basically show you the platform so you know exactly what Cherry is, how it differs in the industry, and then also show you our pricing. We'll, walk you through that. It's very white glove service. If you already know that you want to move forward, we make it even easier where you can just go through our underwriting process. It takes about 5 minutes on the call with the AE. If you need to think about it for a week, that's totally fine too. We can send you the link to get started. But really 2 ways to really make it as seamless as possible. And then the last and final step to get ready is an hour-long call with our onboarding team, where I think, in my experience, this is the most impactful call because, as I mentioned, it's one of the things that we do really well, where we want to invest in your team, in your office, and teach them how to actually leverage financing in ways that they might not have been doing it in the past. So we'll go through about 45 minutes of training with that. And then the last 15 minutes is implementing that marketing, talking about different ways that we can do maybe an email blast to your patients that didn't move forward, that came into the office in the past year, but didn't actually move forward. Odds are cost might have been one of the biggest, or it might have been one of the reasons, if not the biggest reason why people didn't move forward. So letting them know that there's a new option out there, seeing if they can get approved right away. So 3-step process: meet with the rep, underwriting, and then onboarding. And then, of course, one of the things that Cherry also, like, I think really does well is we have customer success reps and practice development managers that will also, depending on where the practice is, either be remote or in person. And that will be your long-term rep, someone to check in, do additional trainings with new staff. If you guys are having events, they can help you with that as well. But really just an internal Cherry advocate for if you have any questions about the platform, go over new features, all those really great things.
Wow, that seems like you guys have a lot of like a white glove service, walking people from step by step. So you're not saying, hey, here's the link, sign up, and we'll get you onboarded and we'll see you later. You have actually a step-by-step process. And then you have the education and training portion, because like you said, doctors are doctors. They don't have the time to sit there, figure it out, and then train their team. You have a training that's specific where everybody can kind of go through it, and even have a customer success rep that's going to walk them even further depending on where they're at, or if they're having challenges, things like that with the platform, or how to introduce Cherry. So you mentioned something about if you're having an event. What does that mean? Like how would Cherry help us, like if we're having like an appreciation day or an open house, or we are going to an event? Because a lot of our people will do community events. So what would that look like? How do you guys help with that?
Yeah, good question. So I think one of the biggest things where we provide a lot of value for those events is creating some additional marketing resources for you guys. So whether that's just letting people know, like, hey, get approved right now, we can create a custom QR code for your approvals so that you guys can capture leads in that way by them applying to financing. You already know, hey, this person's going to get approved for $15,000 if I'm going to have an open house. Like that's $15,000 that they can use towards their treatment that, is really impactful to both the patient and then also to your business. So that's one of the biggest ways. I think creating what we call treatment or like pricing guides that basically shows, let's say it's an open house and you're doing a promo of some sort. So it'll show like, hey, here's maybe a, 10 session, like, thing that you're offering up to your clients. And then here's what that cost would be if paid over time, whether that's 6 months or a full year. So our team's really great about doing that. And then if it's an in-person rep, they'll also just go to the event themselves, where they can say like, help patients get applied, help schedule those patients for consultations, and make sure that all those things prior to the consultation are taken care of before they actually go into the consultation. So, yeah.
Awesome. Okay, well, we'll definitely have to, we'll dive in a little bit more on that. I know that we have a webinar that we're going to be doing on August 19th. So first, I just want to thank you for being here and kind of giving us a little bit of insight as to what Cherry has to offer, how you're working with chiropractors, med spas, and all the other providers as well. But we have a webinar that we're going to be doing on August 19th. So I want to invite everybody there. Can you tell us, like, why should people be there? Why would I want to show up on August 19th? What are we going to be kind of discussing and kind of going over during that time?
Yeah, absolutely. So apart from just like speaking about all the things that makes, Cherry so great or different in the space, what I really want to focus on is how we're going to increase or how we as a company really help your practices increase case acceptance and then also ticket size to ultimately impact revenue. So those will be those tips and tricks and tools that we do. And yeah, would love to see everyone there.
Perfect. Well, Fiona, I want to just thank you again for being here, kind of giving us the insight as to what you guys are doing in this space. I know this is really, really needed. A lot of our providers just need that extra, something in their back pocket that, hey, if a patient presents this, I have an option that is more accepted, right? You guys are working with a lot of different people, subprime, which is really good. And so I want to make sure that everybody knows that you're all invited. Bring your team. If you have questions, Fiona's going to be there answering your guys' questions. So show up live. And again, thank you very much for being here today. I appreciate it.
Of course. Yeah. Super excited.